Hello everyone. We have wonderful session. We had wonderful session by Dr. Sujata. Now let's move on with academic session 4, which is taken by Dr. Gul Baltaci. She is a professor. She had been a long time chair of the KTI Research Committee. She graduated from School of Physiotherapy and Rehabilitation as at Haltesp University in 1986, completed Master in Science degree in Exercise Physiology Department in Middle East Technical University in 1990, and PhD in Physiology Department in Ghazi University Medical Faculty in 1994. She served on the faculty of University from 1995 to 2014, where she initiated and participated in numerous kinesiotaping research activities. She continues to mentor high-level research as coordinator of physical therapy and rehabilitation with Guven Private Hospital, Ankara. And today's her topic for lecture is effects of kinesiotaping on pain. Thank you, Dr. Gul, and now over to you.
Hi, dear distinguished participants. I would like to share, first of all, my screen. Yes. First of all, thank you for inviting me to this symposium. Your invitation honored me. When I first came to the International Federation of Hand Therapists Congress in New Delhi in 2012, your country fascinated me. The colors, atmosphere, and fun people in your country were incredibly impressive. Without COVID-19, perhaps we will be together in a face-to-face symposium in future. I hope to come to your country once more. Now, I would like to introduce myself. After retiring from Hacettepe University in 2014 as a lecturer, I have been starting to work at a physical therapy rehabilitation department in a private hospital in Ankara as a coordinator. Although we work with all medical branches, we are planning both functional rehabilitation and exercise prescription for healthy individuals in the center of wellness, besides intensive care, cardiology, orthopedics, inpatient, outpatient, in geriatrics and neurology and cardiac rehabilitation patients. Meanwhile, we use kinesiotaping very frequently in both research and treatment programs. Now, today I would like to give a presentation entitled The Effects of Kinesiotaping on Pain, Related Evidence-Based Applications. Now, when I was as an instructor in Albuquerque 2008 with Dr. Kasse, and actually I had learned a different kind of physiological effects of kinesiotaping. Kinesiotaping, it stimulates proprioceptors which respond to position, pressure, and stretch, and also stimulates mechanoreceptors, and then facilitates lymphatic drainage by lifting skin to create an area of low pressure. And kinesiotaping is a therapeutic taping. You know that the technique developed by Dr. Kenzo Kaze over 40 years ago. The tape is typically applied over and around muscle to prevent overcontraction. Kinesiotaping is used to decrease pain and inflammation by improving lymphatic and blood circulation without restricting the range of motion of affected part. This technique relieves pressure and irritation of the nociception receptors that can create pain. Now, that one is the mechanism for pain relieving effects through the stimulation of sensory pathways in the nervous system by increasing effort feedback and by diminishing the input from nerve fibers conducting nociception due to the gate control theory, like transcutaneous electrical nerve stimulation. And by lifting the skin directly reduces pressure on subcutaneous nociceptors like epidermis and dermis and fascia. Now, the mechanism and is related to the myofascial pain control. Pain is partially mediated via the endogenous mechanism of brain term the medial nociceptive system, which is thought to contribute to the emotional component of pain. This system is believed to be influenced by patient expectation, which in turn reduces pain via descending inhibition and the release of opioids. And furthermore, as you see in this slide, the tape macroscopically lifts the skin after applying kinesio taping. Did you see the epidermis and it has and convulsions and also lymphatic drainage and thus reducing inflammation in the affected areas. Now, we say literature about kinesio taping and pain. And when I searched in the PubMed, 208 articles found it, and searching in details, control clinical trial 86 and randomized control trial 83 articles found in these areas. Now, I also note a trend suggesting that the kinesio taping might improve pain-related outcomes when used as an adjunctive modality to physical therapy. Now, the literature review on pain in kinesio taping has two different types of research articles, effects of pain, and one of them is related to kinesio taping versus no treatment. Secondly, kinesio taping versus sham taping. And thirdly, kinesio taping versus other interventions. And four, kinesio taping plus other interventions and versus other interventions alone. Now, let's take in details all of the articles and in this presentation. And actually, I would like to explain in details the kinesio taping versus no treatment. Firstly, and did you see this slide? The kinesio taping using in epidermis and dermal areas. And the authors found that the epidermal-dermal distance and may reduce the sensation of pain, edema, and inflammation. This is a good research article published in Physiotherapy Theory and Practice in 2015. And then another research article from our department and then published in the Journal of Sport Rehabilitation in 2019. And actually, we found the same results like the previous studies. Muscle soreness returned to baseline values 72 hours. So 22, 24 to 72 hours post-exercise only, pain reduced again. Now, these studies related to my assistant's Master of Science thesis, the effect of kinesio taping application in surgeons who have musculoskeletal pain after performing surgery. Kinesio taping would be an effective method for reducing neck and low back pain and improving functional performance. We applied just 3 days, and last day, 4th day, and follow-up period for kinesio taping effects on the lower back and back areas. Did you see this slide? The first and upper level of figure related to neck pain, and it shown that the daily changes. And secondly, lower back change totally, and daily of the lower back pain and visual analog scale, and 4th day reduce completely. And then the other studies show that a different kind of methods in applying kinesio taping by using correction methods and considering its mechanical correction effects. taping may be used an adjunctive technique to decrease pain and improve performance during daily activities and our exercise programs. And second one is related to effect of kinesiotaping versus sham taping. We have a lot of articles related to sham or placebo studies. And the studies involve participants with patellofemoral pain, osteoarthritis, shoulder, weight pain, and whiplash or low back pain. The outcomes evaluated were pain and disability. Kinesiotaping was either no more effective than sham taping, or its effect was too small to be considered clinical worthwhile. And some of studies show that no benefit in decreasing pain. This upper level of studies is related from my assistant's thesis and related to just only patellofemoral pain syndrome. And again, the bottom of this study from, again, Turkey, and no benefit in decreasing pain by using a sham method. And on the other hand, some authors found that the kinesiotaping has positive effect in reducing of pain in knee osteoarthritis. This is a good result for applying kinesiotaping. Another articles related to the shoulder pain. Now, on the other hand, I can explain in details the meaning of the sham and placebo. Placebo, same tape and different technique. Sham, different tape, but same technique. And actually, and if the kinesiotaping does indeed function via descending inhibition or some similar mechanism, it is possible that the placebo kinesiotaping provides enough stimulus have a therapeutic effect in terms of pain reduction. Now, although the Talon, this is the first study for shoulder pain or clinical efficiency, and showed an effect of time on pain with the application of kinesiotaping in patients with shoulder impingement. And similarly, and Gonzalez Iglesias, this study published in Journal of Orthopedic Sports Physical Therapy in 2009, and actually demonstrated that pain was significantly lower in the kinesiotaping group than the placebo kinesiotaping group immediately and at 24 hours post-application in patients with acute whiplash injury. Now, next study is related to a patient with chronic low back pain, and Castro Sanchez et al. Found that pain reduced significantly over placebo kinesiotaping after 1 week of kinesiotaping wear, and reduced pain and disability symptoms. Now, next study compact of the related to the other interventions, including physiotherapy modalities and electrotherapy and exercise. Now, according to published research studies, revealed the significant advantages effect of kinesiotaping and over other non-invasive techniques in the improvement of intensity at post-intervention and follow-up. 2 studies were single studies with low risk of bias involving participants with chronic low back pain and mechanical neck pain. We studied on this slide, we show that the additional effect of kinesiotaping. Another group received that the mobilization techniques, including and the Syriax mobilization techniques for trigger points in cervical region. And then there were no differences in headache intensity, neck painless time, and quality of life between both groups. We can use always that the kinesiotaping instead of manipulation techniques in this study. And another study is related to chronic low back pain patients, and actually the authors use by measuring of the electromyography electrodes during the worm bending, and then divided into 3 groups: kinesiotaping plus exercise, kinesiotaping alone, or exercise alone. The best one is therapeutic exercise plus kinesiotaping effects, short follow-up period, and completed the best results. And then another articles related to patellofemoral pain syndrome. And Compola, the law of the slides, and below of the slides, and as you see, that Compola et al. Showed that the kinesiotaping did not have significantly greater benefits than McConnell patellar taping for anterior knee pain. And actually, it has similar effects for reducing pain and disability function. And then the overall kinesiotaping effects on Friedman said that did not report between group differences in pain severity as a continuous outcome at equivalent time points, but did report significantly more rapid resolution of symptoms with kinesiotaping than with physiotherapy. And another articles related to, again, from our department, my assistant's Master of Science thesis in basketball players with chronic inversion ankle sprains, published in 2011 in the International Journal of Sports Physical Therapy. The other one is related to massage versus kinesiotaping. And then overall, the effects of that, the more rapid reduction of pain in trigger neck pain problems. And we published a new article in the knee. The kinesiotaping has more effective at enhancing knee strength and decreasing pain intensity and self-reported knee function in anterior cruciate ligament reconstructed patients. The article published in 2016, especially ACL reconstructed individuals with higher kinesiophobia levels. And then the other articles, again, related to kinesiotaping versus exercise. We studied on the caesarean section of the woman abdomen and the effect of exercise are versus kinesiotaping. Another one is related to low back pain, and this one is the kinesiotaping provided significant improvements in pain and disability. Just new published last month, published in peer-reviewed journals, Science Citation Index journals in clinical rehabilitation and effects of kinesiotaping versus compression stocking on pain, edema, functional capacity, and quality of life in patients with chronic venous disease. This is again a randomized control trial, and stocking is the best results than kinesiotaping, but kinesiotaping intergroups and before and after studies, the symptoms of pain and edema decreased, functional capacity increased, and quality of life improved. Now, this is the just new finished studies related to the sterile kinesiotaping application. As you see in this slide, this is a new precut EDF sterile material, and our orthopedic surgeon, Dr. Atay, applied during surgical skills in patients with anterior cruciate ligament reconstruction, and we have a different kind of positive impact for reducing pain and edema at 22 hours for 72 hours for surgery incision level and upper leg in patients with ACL reconstruction, not published and just finished and last 2 months ago. And next one is related to effect of kinesiotaping plus other interventions versus other interventions, including manual therapy, shockwave therapy, and exercise program, including all of the physiotherapy and rehabilitation modalities and invasive, non-invasive materials. In the evaluated outcomes, kinesiotaping was no better than other interventions alone for participants with rotatory cuff lesion or an impingement shoulder syndrome, chronic neck pain, patellofemoral pain syndrome, and tennis elbow. Now, that the study, we studied on subacromial impingement syndrome, and actually all patients kinesiotaping and exercise group and manual therapy and exercise group are divided into 2 groups, and then kinesiotaping may have adjunct effect of reducing night pain immediately. That one is no difference between reducing for pain and disability function. Now the groups, all of treatment protocols 2 times a week and totally 6 weeks. Then the pain decreased immediate after application, especially in reducing the night pain. Now that one is another studies, again, in neurologic rehabilitation and kinesiotaping and versus and kinesiotaping and the other protocols inside in this study, and published in 2017 Journal of Rehabilitation Medicine. And kinesiotaping may be an alternative treatment option for stroke patient with hemiplegic shoulder pain. Now, another study from our department, short-term effects of high-intensity laser therapy, 1 group, and 2nd group manual therapy, and 3rd group kinesiotaping, and last group just only an exercise program in patient with subacromial impingement syndrome. All 3 groups and first 3 groups plus received plus exercise program for glenohumeral joint. And then this study published 2 days ago, Korean Journal of Family Medicine, and we have 4 groups in low back pain without neurologic deficit. 1 group received pretzel exercise manual therapy programs, including some of maneuvers like that, the pretzel, and some of the mobilization techniques according to CREAX, and plus stabilization exercise. 2nd group, reflex therapy application plus stabilization exercise. 3rd group, kinesiotaping plus stabilization exercise. And 4th group just only received stabilization exercises. Then we published this article 2 days ago, as I mentioned before that. And then kinesiotaping, after applying all the muscles, and immediately reduced the pain. And then the decreased kinesiotaping, the results. Actually, the other studies just new published in some of journals and related to perimeral dysmenorrhea, and another one is a chronic low back pain and hand osteoarthritis, and slip bruxism, especially chin retraction maneuver in a occlusal splint versus kinesiotaping. And the results, again, the results good, applying kinesiotaping with the other interventions. Now, this is an interesting study, just new published in Journal of Bodywork Movement Therapies in 2017. And then there are three groups in this study. And then one of them is related to received just only patellomedalization technique and upper level of the slide. And another group, kinesiotaping lateral rotation of the femur and tibia. The last group, no treatment. Just only three groups received plus exercise programs. And actually, did you recognize in this slide the two kinds of kinesiotaping methods? And one of them is, again, in the metallization of the patella, and second one, rotation of the tibia and also femur, both of the mechanical correction technique and also reduce the pain after 12 weeks, and showed in figure that the reduced pain immediately, lateral rotation of the femur and tibia, the best one, and the red circle. And we completed the studies related to lateral epicondylitis, and actually we studied, finished in 2015, presented in 13th Symposium in Tokyo, and annual research symposium, during annual research symposium, and lateral epicondylitis. After 2 years, we published this research study in peer-reviewed journal, Knee Surgery, Sports Traumatology, Arthroscopy, and actually three groups were here. Then first group, physiotherapy, kinesiotaping, and second group, physiotherapy, shockwave therapy, and third group, kinesiotherapy, taping, and shortwave therapy. The best result in the study, kinesiotaping plus physiotherapy, showed better results, short-term intervention in decreasing pain during activity after 6 weeks than the results. Now, what do we learn about pain up to here? Now, actually, we have different kind of research articles, and the 4 research types I mentioned before that, all of the overall results of this research, and it provides immediate pain relief in the first 24 hours following application, and no studies long-term outcomes. Muscle and tendon kinesiotaping application are better with supervised exercise program, especially mechanical correction of kinesiotaping and EDF applications better than the others. And actually, future research on kinesiotaping on pain, especially in those patients utilizing a placebo, should focus carefully on controlling for patient expectations. Now, what about the failure of research? And the research studies have small sample sizes, no long-term follow-up, no power analysis, use of fake kinesiotaping. This is not original. You recognize from research studies kinesiological tape, key tape like that, and this is not good results. And placebo versus shame. The meaning of these terminology is important for this of the research studies. Failure of methods and failure of techniques in research study. What about the take-home message? For going home, for taking some message about kinesiotaping, the most cost-effective, the most time-effective, the most user-friendly, the one that works best for patient, and it can be applied by the patient. And additionally, subsequent research articles should use more measures such as pain-free range of motion and disability indices, as pain is a partially psychologically mediated outcome measure and need more research studies, including randomized control trial, clinical trial, or control clinical trial. And thank you for your attention, and greetings from me for all physical therapists during this meeting. Thanks, Lan.
Now, hi everybody. And actually, my name is Gul Baltaci. Greetings from Turkey. I'm gonna answer some of questions here, and then one question is related to strapping tape and supporting taping is commonly used by our clinicians. Is there any difference? Yes, of course, there is a difference because of the supporting taping is related to actually the rigid or athletic tape, which is fix up joint or muscle for injured area, like or cast of materials, and strapping tape like elastic tape or elastic like an elastic bandage, and then this is a good material, but not fixed up the joint or muscle. You know that the joint is a flexible and, example, knee joint, and is responsible for just only a flexion and extension. While walking during activities, you can not fix up the on the joint. But kinesiotaping and supportive tape is a good material for fixed up the joint. And then the part of treatment program, we can use, of course, both of materials in that time. And another question is related to difference between the colors of taping. No difference, each color affects. The only all of the materials organic, according to the tree of lie down, and then the material, and actually there are 5 different colors in kinesiotaping: beige, blue, red, white, and black. These are all of the, as I mentioned before, that the organic materials. And another question is related to which one is water resistant materials, and the new one is material Performance Plus, which is a new one. We always use in athletes, especially in tennis players. Last study completed the 2 months ago. Finished this results of this study. We will be published next month. And actually, and all of water resistance, no problem. Just only related to the salty or like sea after swimming. Your an exercise program for this one, you can fix up on your skin. And the other question is related to in hemophilia patients. Can we use in hemophilia patients having muscle bleeds or joint bleeds? And actually in hemophilia patients, this is really careful areas and careful skin area, and we have to be careful is any allergic reactions, or we cannot apply on bleeding area. And of course I always work with the doctors, and I can ask some of applying kinesiotaping in that areas to his or her doctor. Now, is this temporary treatment? To another question, Dr. Poja Digra. And no, I don't agree with you. And actually, the kinesiotaping, as you see in some of research articles, and real treatment, alternative treatment approach. And you have to support other treatment options, including some of exercises, and regarding Pilates, yoga, and calisthenic exercises, and electrotherapy or injection therapy, or the manual therapy techniques, as you see in research articles. And you have to use these materials while running and while jumping, and some of athletes, and it is very easy to use the support all of muscles and joints and ligaments. Now, another question is it effective in varicose veins? No, I don't think so. And varicose veins is really dangerous applying for this area, because you know that related to the heart and muscle, the problem. And actually, this is a good question, but we cannot use in all veins area. Of course, we use the lymphedema, reducing the lymphedema areas, and actually Nihan will be mentioned about after two speakers, but this is not good, the varicose vein in aggravated the symptoms. And how kinesiotaping could be useful patients post-stroke? Of course, we use the different kinds of techniques. One of them is especially, you know, that the shoulder problems for the patients, subluxation of the shoulder, hemiplegic patients. I use always for the sensory motor integration for the hands, applying the EDF techniques for each finger to the elbow, and another one is used related to functional method of kinesiotaping while walking without restricted or the foot. I always use the foot for the drop foot problem. And then another one is the fixed up the application for the mechanical correction for the actually to the shoulder, not only forward position and backward, hold on here, and then keep that position for the fixed up the correction of the posture. Then how kinesiotaping could be useful? Yeah, I mentioned that. Varicose veins. Then the last one, is there immediate and long-term effects of kinesiotaping on balance and functional performance? We don't have any studies and long-term effects of kinesiotaping, but yes, immediate effects a lot. I use always these parameters, especially balance and functional performance in athletes. And besides the post-stroke patients and disturbances of the walking problems, and after surgical skills for the osteoarthritic patients, especially after applying arthroplastic patients, that one is a good reaction for correction of the that one is functional performance and balance problems. And it is very easy to use the technique of kinesiotaping on the immediate and the long-term effects, but we don't have any studies and long-term effect. Of course, we can do that easily, but at my hospital, we cannot figure out the patients of the treatment protocols long-term effects of any treatment modalities. Now, actually, can we use Kinesio tape for correction of genu recurvatum in small kids suffering from spastic paraplegia? Yes, we always use that one as a Kinesio taping for correction of genu recurvatum in especially in spastic cerebral palsy patients. And then we have a lot of patients and related to the genu recurvatum problems in spastic paraplegia. Always we use that one, the technique of the mechanical correction, 50 to 75% of kinesio taping in the knee joint. And then this is good materials for using. Then the brace material for each children. And then another question might be its effect on balance. Balance because we can also use taping as a biofeedback. Yes, very good. And we have an article related to the balance and especially performance parameters for the taping by using a biofeedback. But my subject is here just only reducing of pain or no effects of pain in literature. I can explain in details, or I can send a research article to you. And which techniques should be used, either inhibition or support for pain reduction? Now, there are two kinds of options here. One of them is related to if the new patient, the patient has new acute problems, new problems and knee injury. Of course, we use just only using the kinesio taping materials distal to proximal or insertion to origin of the muscle. This is good material, and actually then the support the fixed up the rest of time or injured area. Another one is the supporting of the joint or injured area, and we can apply that if the problem is not acute, only chronic problems, or supportive the area of or increase of the functional performance. Of course, you can use that facilitation technique, and this technique is related to the only proximal to in that area to distal side, or origin to insertion of the injured area or the muscle. That one is it means that entitled facilitation techniques. Another one is inhibition techniques of muscle. We use just only for muscle techniques. And another problem is related to the we use the fixed up the joint for only using that mechanical correction 50 to 75% of tape support here. And then share your email. I'm going to write here Gul.Baltaci @gmail. Okay, Dr. Ankit?
Yes, I will post it on the screen. Just post it on the comment section, ma'am. Yeah, I'll just post it on the screen.
I have three emails, but that one is my private email, Gul.Baltaci @gmail.com. Okay.
There is a very nice compliment for you, ma'am. Thank you, ma'am. The good teacher explains, the superior teacher demonstrates. Thanks for wonderful responses. And I'm really thankful to you too. You have joined us as a speaker, and thank you for your wonderful knowledge. And we will be keep in touch with you. Thank you so much.
Now, thank you very much for everything. This is a really good e-conference for Kinesio Taping, and actually we can share all of experiences and information by using this conference. And thanks a lot for your organization of this meeting, Dr. Ankit. And actually, I hope I will come to your country. It's really impressive and really good people, really fun people, and every color is really nice. Thank you.
I will definitely invite you, and so that you can give your complete knowledge to our students, those who are not able to join this session. But definitely we will soon work it out, and definitely I'll invite you in my university, and I'm giving you the formal invitation now itself, so we will plan up for it.
Thank you. Bye bye.
Thank you. Bye bye, doctor.